Hello and welcome everyone to the MCQs next, where we are starting the revision series for pharmacology subject, and it is very important for DHA pharmacy exams, NEET PG and FMG, and with special stress for DHA pharmacy exams according to their curriculum. And you can join our YouTube channel Shishu Care for more such videos. So, what we have planned in this revision series is that we will be uploading lectures, short lectures, which will comprise, each lecture will comprise about 25 MCQs with answers and little explanation. And we have divided uh, important topics into different segments. So, uh, like this is class first class, and the topic is toxicology, first part of toxicology. So, what I believe is that you all guys have many textbooks and guidebooks and material online here and there available where you can read pharmacology. But MCQ practice is very, very, very important in any of such competitive exams and MCQ exams. And this is the point where most of the students lack. So, my aim is to just give you practice for these MCQs, and the videos are going to be short, around 20 to 30 minutes mostly, so that you can easily go through these videos at any time of the day and revise these MCQs. Okay, so without wasting much time, we will be starting this first lecture of toxicology. So now the first question is antidote for organophosphate poisoning is. So just wanted to tell you that whenever you are reading about any poisoning, not about organophosphate, any poisoning, three important things. What is the mechanism of that poison? How it is acting? What is the pathology behind it? What are the clinical features it is causing? And the most important thing is which is the antidote which you are using for that poisoning treatment. So antidote for OP poisoning is palytoxin, atropine, flumazenil. Now, in this question, I also want to tell you something about how to prepare your MCQs or how to develop your MCQ solving skills. Now, what mistake usually we or everyone does is that while looking at the first option or second option, you feel that that option is right and you just take that option. But later you come to know that that was the wrong option because the important part is you have to go through all the four options and then think twice and then pick the correct answer. Because sometimes what they do, the examiners or MCQ setters, they put the first option which is very closely resembling the correct answer, but that is not the correct answer. Other thing is, many questions contain such options like both A and B or both B and C, and many questions contains all of the above. है ना कि सारे options सही हैं. Many questions also contains none of the above. So these are the important things we should remember without before solving any MCQ. So in this question also now, which is the antidote for OP poisoning. So antidote for OP poisoning is both A and B, that is pyridoxine and atropine. So what organophosphates usually does, OP poisoning, it inhibits the acetylcholinesterase enzyme. So enzyme is there, acetylcholinesterase. ये enzyme क्या करता है? It breaks down acetylcholine. So acetylcholine is there and acetylcholinesterase will break down the acetylcholine, that is decrease level of acetylcholine. Now when anyone ingests OP by mistake or due to any cause, then it inhibits this acetylcholinesterase enzyme. So इसका breakdown कम हो जाएगा, तो what will happen? Acetylcholine level will increase. So OP leads to increased excessive acetylcholine levels. And these are the antidotes. Atropine blocks the muscarinic effect. This is another MCQ question. There are two types of effects in case of increased acetylcholine levels or OP poisoning. First is muscarinic, and the other effect is known as nicotinic effect. So atropine blocks the muscarinic effects. Prelitoxin, it reactivates the acetylcholinesterase enzyme. ये जो enzyme block हो गया था, prelitoxin will again reactivate this acetylcholinesterase enzyme, and so acetylcholine breakdown will happen, and this increased level will come to normal. So this is how these antidote works. Now the second question: the earliest sign of OP poisoning is, what is the earliest sign? Bradycardia means decrease of heart rate. Bronchuria means increase bronchial secretions or lung secretions. And third is meiosis. Meiosis means like this is normal people, so meiosis is small size people, and mydriasis is large size people. Meiosis and muscle fasciculations. So, which is the earliest sign? The earliest sign is meiosis. Meiosis is usually the earliest and it is the most consistent sign of OP poisoning. And fasciculations, it occurs later. Another MCQ point, fasciculation is which type of effect? It is nicotinic effect, not the muscarinic effect. Now, very important, sludge, SLUDGE. This is a mnemonic used for the syndrome which is seen in poisoning with. So, sludge syndrome is seen in poisoning with organophosphates. So, in case of OP poisoning, this sludge is mnemonic and each of this alphabet stands for something. So, S stands for salivation, that is increased salivation. L stands for lacrimation, that is increased tears from eyes. U stands for increased frequency of micturition or urination. D stands for defecation or for diarrhea, means increased frequency of stool or loose stool. G stands for GI cramps, that is abdominal pain, and E stands for emesis or excessive vomiting. So these are the symptoms in OP poisoning, which is usually remembered with this mnemonic sludge. So this sludge happens because of muscarinic excess due to acetylcholinesterase inhibition. So this is another MCQ question. Sludge happens because of muscarinic effect. Now, next question, which poison causes cherry red discoloration of skin? Skin का cherry red discoloration is caused by cyanide, carbon monoxide, methanol, or arsenic. So this is caused by carbon monoxide poisoning. Cherry red discoloration, how it happens? Carbon monoxide, it binds with hemoglobin and it leads to formation of carboxy hemoglobin. That carboxy hemoglobin gives cherry red discoloration to skin. So this is rarely seen in clinical practice, but for exam it is important. Now, question number fifth, antidote for cyanide poisoning. Cyanide poisoning antidote, hydroxycobalamin, sodium nitrate, sodium thiosulfide, or all of the above. So, as I've already said, always go through all the options. The answer is all of the above in this case. Now, how these antidotes work? Nitrite, what nitrites does? It reduces methemoglobinemia. Okay. Thiosulfate, it converts cyanide to thiocyanate, which is less toxic. Hydroxycobalamin directly binds the cyanide. So, ये भी question आ सकता है. This is important one. That which of the following antidote of cyanide poisoning directly binds cyanide? So all three options, and the correct one is hydroxycobalamin. It directly binds the cyanide. Next question, methanol poisoning primarily causes. Methanol poisoning causes renal failure, hepatic necrosis, metabolic acidosis, visual loss, and respiratory alkalosis. So what basically is methanol poisoning? As we hear sometimes in news, that contaminated liquor, जहरीली शराब है ना, contaminated liquor, it contains methanol. So it leads to methanol poisoning. And what happens in methanol poisoning? Metabolic acidosis with visual loss. So if a patient comes with a history that he has ingested some local shop alcohol, and after consuming that alcohol, he is suffering with decreased vision or sudden vision loss, then methanol poisoning is to be suspected. Now, methanol, what it does, it metabolizes to formic acid. Main toxicity is because of formic acid, not because of methanol. So, methanol metabolizes to formic acid. It causes severe metabolic acidosis plus optic nerve toxicity. So, optic nerve toxicity leads to decreased vision or blindness. So, this is how methanol poisoning happens. Now, what is the antidote for methanol poisoning? It is alcohol versus alcohol. Sharab versus sharab, you can remember. For methanol is also alcohol, so antidote for methanol poisoning is someone suffers with methanol ingestion, then you can give him ethanol. So antidote for methanol is ethanol. Ethanol competes for, now how ethanol works as an antidote, it competes for alcohol dehydrogenase enzyme, and hence it prevents the formation of formic acid. The toxic compound is formic acid, not the methanol, and ethanol competes with alcohol dehydrogenase. So this is again important point. Each of these line can be asked as MCQ. So now next question number 8, which poison causes garlic-like odor? Garlic-like odor is caused by arsenic poisoning. In arsenic poisoning, it is garlic odor. Other thing about to be remembered, it also causes severe GI irritation and diarrhea. So sometimes it can be asked which of the following is not the symptom of, it's not the, always be aware with not the. Okay, this not word is very important. In MCQ question they ask not. So arsenic poisoning, which of the following is not symptom or feature? So garlic, first option will be garlic odor, second option will be GI irritation, third option diarrhea, and fourth option suppose hematuria. So which is not hematuria. Okay. Now antidote for arsenic poisoning is again trimercaprol. Antidote questions are very important. Always remember antidote for all the poisons which we are discussing. The antidote for arsenic poisoning is dimercaprol. Dimercaprol is also known as BAL, that is British anti-leukocides, and it chelates which two heavy metals, arsenic and mercury. So dimercaprol chelates arsenic as well as mercury. Now, which heavy metal causes wrist drop? Very important. Wrist drop, that is unable to lift the wrist or unable to what we can say extend the wrist. So wrist drop is caused by which heavy metal poisoning? It is caused by lead poisoning. Few points about lead poisoning. Lead poisoning, what it does, it causes peripheral neuropathy, that is damage to the peripheral nerves, and wrist drop is the important or classical feature. The thing, which type of neuropathy, if we go into detail, then lead poisoning leads to pure motor neuropathy. Okay, these are important points about lead poisoning. Now, antidote for lead poisoning in children, it is EDTA. So, antidote for lead poisoning is EDTA. EDTA is preferred in moderate to severe lead toxicity or in children. Dimercaprol can be used in severe cases if presents with encephalopathy. So, EDTA for moderate to severe and in children. Which poisoning? Next question, question number 12. Which poisoning presents with metabolic acidosis plus increased anion gap? Increased anion gap is also known as high anion gap. Okay, so high anion gap metabolic acidosis is seen in all of the that is salicylates, methanol, and ethylene glycol. So high anion gap metabolic acidosis, that is HGMA, is seen with salicylates, methanol, and ethylene glycol. Question 13, ethynyl glycol poisoning leads to ethynyl glycol poisoning से क्या होगा? Optic neuropathy, renal failure, hepatic failure, or cardiac arrhythmia. So optic neuropathy we have seen with methanol. Okay. So renal failure, ethylene glycol poisoning leads to renal failure. What happens? Ethylene glycol का क्या होगा? Ethylene glycol gets metabolized to oxalic acid while methanol was getting metabolized to formic acid. So the toxic components are different and the original toxin is different or the original poison is different. So ethanol glycol is metabolized to oxalic acid. That oxalic acid calcium causes calcium oxalate crystals deposition in kidney and hence it leads to renal compromise or renal failure. Okay, so ethylene glycol poisoning leads to renal failure. Now, antidote for this ethylene glycol poisoning, ethanol we have read for methanol. Okay, so now this is the trick. You should eliminate any one or two options at least with your previous learnings so that you can make guess about the remaining two options. Like this is 50-50 lifeline. You have four options. आपको पता है you know something at least 50-60% knowledge about option number two and option number four. Then you have only two options left to guess. That is option one or three. So इसमें तुक्का मारा जा सकता है. ऐसा नहीं है कि you know nothing about all the four options and then also you are just guessing because that will lead to negative marking. So antidote for ethylene glycol poisoning. One more thing, it is not important to cover 100% syllabus for any MCQ exams. If you know, if you do at least 70 to 80% of the syllabus and revise that, and finally, if you remember even 50 to 60% of the syllabus, then also you can score more than 70% marks because the remaining questions you can do with knowledge of this 50 to 60% which you are remembering, the facts which you are remembering, because you can eliminate the options. So now antidote for ethylene glycol, you know ethanol for methanol, atropine is for OP poisoning. Okay, in vitamin K, there is no such hematuria or any bleeding tendency seen in ethylene glycol, so you can also eliminate this vitamin K. So these are the things. But again, why I said this? Because this method sometimes confuse you. क्योंकि ऐसा नहीं है कि कोई एक चीज सिर्फ एक से रिलेटेड हो. इथेनॉल poisoning also related with ethylene glycol poisoning. So now what we realize that for methanol poisoning as well as ethylene glycol poisoning, the antidote is ethanol. Okay, तो ये समझाने के लिए मैंने फर्स्ट स्लाइड पे इस तरीके से बोला कि आप ये एलिमिनेट करते हुए आपको लगे कि इथेनॉल का आंसर इज मिथेनॉल, so इसका नहीं हो सकता. बट this is not true in medical science because there are many exceptions as well as there are many such facts which are common for many different topics. Okay, so even in pharmacology, for many drugs there are similar side effect profile, there are similar mechanism of action, and in poisoning also there can be similar antidotes. So antidotes for methanol and ethylene glycol is ethanol. Same principle, it competitive inhibition. So again, a good MCQ question: what is the mechanism of ethanol in preventing complication of methanol or ethylene glycol poisoning? So this is competitive inhibition. There are two types of enzyme inhibition: competitive versus non-competitive. So here, in case of these poisonings, competitive inhibition of alcohol dehydrogenase is the principle of ethanol as an antidote. Okay, so now next question number 15: salicylate poisoning initially causes. Now, one more point I want to highlight: in each and every MCQ, each and every word is important. Okay, so अब इस word इसमें एक एक word पे जाओ आप. Salicylate is the name of poison and initially it is saying initially. Questions can be salicylate poisoning causes, salicylate poisoning initially causes, or salicylate poisoning during the later stage causes. So the answer in this case is respiratory alkalosis. So early salicylate poisoning respiratory alkalosis because it stimulates respiratory center. Late stage is metabolic acidosis. Okay, now the acidosis, alkalosis, these might be new terms for some of you guys. So I want to tell कि सारा interpretation is from ABG reports, arterial blood gas. So while interpreting any ABG report, most of the important four parameters are: we look for pH, then we look for partial pressure of carbon dioxide in that ABG report, then we look for PO2, that is partial pressure of oxygen, and the fourth important one is bicarbonate levels. So pH, how you interpret pH increase. Now normal pH is 7.35 to 7.45. Now if pH is increasing, this is alkalosis. Okay, and if pH is decreasing, it is acidosis. If PCO2 is increasing, then it leads to acidosis. If bicarb is decreasing, then it leads to acidosis. Okay, and the reverse case, PCO2 decreasing, alkalosis, bicarb increasing, alkalosis. So we will not go in much detail about this ABG interpretation. If you want, we can take some other lecture for this topic. But for the salicylate, you just remember for early respiratory alkalosis and for late stage of poisoning, metabolic acidosis. Antidote for paracetamol poisoning, PCM poisoning is very important topic. Even if you are working as a clinical pharmacologist or pharmacovigilance in any hospital, then PCM poisoning you should detect. So antidote is for PCM poisoning is N-acetylcysteine, that is N-acetylcysteine. Okay. Now, what NAC does? N-acetylcysteine करता क्या है? This is very important. It replenishes glutathione. That is, it increases the level of glutathione, and which in turn prevents hepatic necrosis. Now, toxic metabolite responsible for paracetamol toxicity: sulfate, glucuronide, NAPQI, and acetaldehyde. So, for paracetamol toxicity, the toxic metabolite responsible is NAPQI. NAPQI causes hepatocellular injury and it is detoxified by glutathione. That's why N-acetylcysteine it replenishes the glutathione levels and hence it prevents the hepatocellular injury. Which drug causes opioid toxidrome? That is the signs and symptoms of opioid toxicity: diazepam, morphine, atropine, or cocaine. So morphine is the drug which causes opioid toxidrome. And what is opioid toxidrome? That is which is the triad of opioid ingestion: pinpoint pupil, plus respiratory depression, plus coma. So if a patient presents with these 3 points, pinpoint pupil, respiratory depression, and coma, then you should suspect opioid poisoning. And which drug leads to such symptomatology? Morphine. Antidote for opioid overdose. Which is the antidote for opioid overdose? Naloxone, atropine, flumazenil, or palidoxim. So for opioid overdose, naloxone is usually the antidote used, and naloxone is pure opioid antagonist. So it prevents the negative effect of opioid overdose because it is acting as an antagonist to opioid receptors. Now, benzodiazepine overdose is reverse pair is questioned with benzodiazepine, and which is the antidote. So, flumazenil, remember this one, important. Many times question has been asked in various MCQ exams. Benzodiazepine antidote is flumazenil. Flumazenil is benzodiazepine, again receptor antagonist, and these two questions, receptor antagonist, and other very important question is, क्वेश्चन ये आ सकता है if a patient is suffering from benzodiazepine overdose, then flumazenil is to be used in caution with patients presenting or patient having history of. So this is seizures. So seizures are any epileptic patient It can precipitate seizures if rumescent is used cautiously. Which poisoning causes hyperthermia in dry skin? Hyperthermia, that is increased temperature in dry skin. These two combination. Organophosphates. Now, if we rule out options, organophosphates we have read about sludge. So there was no such thing about hyperthermia or dry skin. Okay. In opioid triad we have seen, but no such finding. So two options have been eliminated by our previous knowledge of 20 MCQs. Even if we have not read this topic, then also we can eliminate these two options. Now two anticholinergic and benzodiazepines are left. So let's see, it's for anticholinergic poisoning, hyperthermia and dry skin. So what is anticholinergic toxidrome? It is as common saying, hot as hair, is hyperthermic, dry as bone, dry as skin, and blind as bed, that is decreased vision. So if a patient presents with hyperthermia, dry skin, and decreased vision, so we can blame as anticholinergic toxicity. Example of anticholinergic poison, इनमें से कौन सा anticholinergic है? Atropine, morphine, diazepam, propranolol. I suppose you have not read about this question, but with your previous knowledge, let's try to solve this question. Okay, so anticholinergic poison means anti. We have read about OP poisoning. Okay, what is happening in OP poisoning? Acetylcholine esterase enzyme is getting blocked. So breaking down of acetylcholine is not happening. So what is increasing? Acetylcholine levels are increasing. Now this is acetylcholine. So anticholinergic means something which is acting against acetylcholine. So acetylcholine was getting increase in OP poisoning. The final outcome of OP poisoning was increased acetylcholine levels. So what antidote we were using? Atropine and pralitoxin. So we have seen that atropine was acting against the muscarinic side effects. Okay, so anticholinergic acetylcholine, it was acting against acetylcholine. So atropine is in this option. So we know that anticholinergic atropine is anticholinergic. Now increase or poisoning means increased levels or toxic levels. So anticholinergic poisoning example is atropine. Now, which poison causes blue lines on gums? Mercury, arsenic, lead, or silver? This is to be remembered, important. Lead poisoning. What we have read previously about lead poisoning is this is Bertollian lines seen in gums. So, lead poisoning, Bertollian lines. Again, wrist drop is was a classical feature we have read. And peripheral neuropathy. Which type of neuropathy is pure motor neuropathy? These were important points we have read for lead poisoning. Now, question number 24, carbon monoxide poisoning shifts oxyhemoglobin dissociation curve. This is again important topic. CO carbon monoxide poisoning shifts oxyhemoglobin dissociation curve to left side. Now, what it does, carbon monoxide increases hemoglobin affinity for oxygen. That is, it doesn't allow hemoglobin to leave oxygen. It has increased affinity. ठीक है, बॉन्डिंग बढ़ा देते हैं. कार्बन मोनोऑक्साइड क्या करता है? हेमोग्लोबिन एंड ऑक्सीजन की दोस्ती बढ़ा देता है, इंक्रीज फ्रेंडशिप. So hemoglobin does not allow oxygen to enter into tissues, so it leads to tissue hypoxia. Okay. Now let's see about this oxyhemoglobin dissociation curve. This red line is the normal curve. This is green line is shift to right, and this blue line is shift to left. Now what is happening? Shift to right means ये देखिए, ये partial pressure of oxygen है, ये hemoglobin saturation है. Now if we see that इस hemoglobin saturation पे, ये hemoglobin saturation है और इस पे ये PO2 लेवल है. ठीक है, और यही सेम पे ये यहाँ पे left, if the graph is shifting to left, then this is the PO2 level. What this indicates, PO2 levels means level of what we have read in ABG in few slides earlier, that PO2 means the partial pressure of oxygen in blood. So shift to right means that this hemoglobin is releasing more oxygen, and the more oxygen is getting released in blood and entering into tissues. Okay, so decreasing affinity, दोस्ती hemoglobin और oxygen की क्या कर रहा है? कम कर रहा है. ठीक है, decreasing the friendship of hemoglobin and oxygen, so the increase oxygen unloading. Oxygen is getting entered into tissues. While when the air is shifted left, it is increasing oxygen affinity, so decrease oxygen unloading. What it is doing? It is increasing the affinity of hemoglobin and oxygen. इनकी bonding बढ़ा देता है. So oxygen unloading is decreasing. So tissue hypoxia will take place. So these are this carboxyhemoglobin. What it does? It decreases the oxygen unloading, it increases the oxygen affinity. So oxyhemoglobin curve is shifting to left. I know this is a bit complicated, but if you go through this many times, then you will just remember. Okay. Now, last question for today's session: universal antidote. Universal antidote means universal means acting against any poison. Universal antidote is now all of the above, that is activated charcoal, tannic acid, and magnesium oxide. But this was a traditional concept. Nowadays, it's not used. But even today, if a patient presents with unknown poisoning and if you want something to act as universal antidote, then you can use activated charcoal because what it does, it decreases absorption of that particular poison from GI tract. So activated charcoal is used as an universal antidote, but traditionally we should remember these three names: activated charcoal, tannic acid, and magnesium oxide. Thank you. So these were the 25 questions for today's session. That is our first lecture. And you can subscribe my channel Shishu Care for more such videos in the upcoming days. And please try to share your feedback and comment in the comment section if you want me to improve in any aspect and if any suggestions are from your side. Also, please try to share this lecture with your friends, seniors, or colleagues who are preparing for exams. Thank you very much. All the very best.